What's up, guys? So in today's video I'm going to discuss registered nurse or doctor and why I chose the nursing route. So to start the video, first I'm gonna start by saying, there's always been this misconception of, nurses are females, doctors are males. It's year 2020, and then obviously as time has passed and we've moved forward in society, there have been a lot more male nurses. There's been a lot more female physicians. The nursing field, in regards to males, has been growing and growing, and we need a lot more of them. So to start, nursing for me, I chose nursing. I didn't have a desire, to do nursing right off the bat, to be honest with you guys. So I wanted to do business, I wanted to be an executive, blah, blah, blah. And my parents were like, hey, why don't you get into the health field? So I said, okay, so am I gonna do nursing, occupational therapy, blah, 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 doctor. So I narrowed it down, long story short, to nursing. Some of the reasons that I chose nursing over maybe becoming a doctor are time, money, and work-life balance. So to get into some of those topics in regards to time. So nursing school takes about 2 to 4 years to complete. You can get an associate's degree or you can get a bachelor's degree to become a registered nurse. You can also become an LPN, a licensed practical nurse, or a licensed vocational nurse in the states of California. That takes only 1 year. So I wanted to become a registered nurse. You can get your associate's degree in 2 years, and there's other ways you can get your bachelor's in 2.5 years. It's called a concurrent enrollment program. So to get into the field itself, to achieve your goal, is a lot less time than becoming a physician. A physician, we know you have about 8 to 10 years total of schooling, right? Then you have your residency and your fellowship. So you have 10 plus years of schooling until you're head honcho, making big time decisions. You're your own boss. So that's one huge factor. You're someone who doesn't want to go to school that long. You just want to get into your field, start making decent money, and work your way up. Nursing, for me, was the way to go. And then don't be fooled, the nursing program is by far, guys, one of the most rigorous programs out there. I haven't gone to med school, but I've heard some people say that the nursing program can be more challenging than going to med school. I'm not saying all med schools like that, but just know that nursing program is quite difficult. If I were to have gone the physician route, I would have chosen to be a trauma surgeon. I think surgery is really cool. I think trauma is very fascinating. Just a little random tidbit. All right, point number 2. Physicians, they take their work home. And by that, I mean you're at home, you're on call a lot. You're working constantly. And you might have to put in orders from home. So with nursing, it's you go to work, you put in your 12 hours, you're done. You're not thinking about anything else. You live your life. So the work-life balance, nursing to physician, you have more of a life when it comes to nursing. Now, maybe after you've done, your residencies and stuff, maybe you have more of a balanced life, but remember, that takes 8 to 10 plus years to get to that point. So the work-life balance is far better in nursing in regards to my opinion. All right, so this next point I'm about to make, it's developing more of a connection with your patient. This kind of maybe depends on the kind of person that you are. So as a nurse, you are bedside with that patient, generally 12 hours. So you're developing more of a connection. The doctors, they put in the orders for the nurse to carry out. So you're then there, you're bathing them, you're giving them their medications, they're coding, you're there first generally. I mean, you are their person, their go-to. When they need something, it's on you. So if you're the kind of person who likes to take care of patients and you want to see them get better, which I think is extremely cool. If you have maybe the same patient for a while, they might be super sick and you could see them get better, or vice versa, they could be better and get worse. You're there for them. You're there for their families as well. It's more of a personal relationship when it comes to nurses and doctors in regards to the patient as well. Some doctors, of course, they can choose to spend their time more with the patients. Not all physicians are the same, but in general, we all see it. You see a doctor, they come in there, they say blah, 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 and then they're out on to the next patient. But as a nurse, you're stuck there, you're taking care of them, you're the go-to person. So I think that aspect of the profession is really cool. I'm a people person, so I like that side of the nursing field. Those are just some of my points and examples of why I chose nursing over becoming a physician. And then do not forget that, let's say you kind of want to go in between, you can do both. I mean, there's some nurses who have been doing nursing for X amount of years, they become PAs or they decide to go to med school. I have a few friends doing that. Or you can be a registered nurse and then you want to take that next step. You can become a nurse practitioner, which I've mentioned a few videos before. Again, that's a very big field, it's growing. There are more jobs available as like a family practice nurse practitioner, and rather than like in the hospital setting, that is actually becoming pretty saturated. There's also CRNA. So just a little touch on that. I'm not gonna go into the nurse practitioner videos again or whatever, but that is another step that you guys can take. You're basically like a doctor nurse. Thanks so much guys for watching today's video. Make sure to hit that like button and subscribe, and I'll see you guys next time.